Welcome to the DSO Hygienist Podcast, where we deep dive into the world of DSO hygiene. I'm your host, Christine Deal. I'm a practicing clinical hygienist with over 30 years of experience. 7 years ago, my private practice was bought by a DSO. I am an advocate for hygienists working in the DSO space. Discover how DSO hygienists can advance their careers and make a meaningful impact in the field. From career growth opportunities to in-depth discussions on the challenges and triumphs of the DSO hygienist, in this podcast, we will provide exclusive insights, expert interviews, and real stories from passionate hygienists who are making a difference. You won't want to miss a single episode. Even if you aren't currently in the DSO world, you will benefit from a wide range of topics. Subscribe now to the DSO Hygienist Podcast and be part of the conversation. Your journey to happiness and success begins here.
On today's episode, our guest is Anne-Marie DePalma. Anne-Marie is a graduate of Forsyth School of Dental Hygienists, Northeastern University, and the University of Massachusetts at Boston. Anne-Marie is a fellow of the Association of Dental Implant Auxiliaries, a fellow of the American Academy of Dental Hygiene, a continuous member and fellow of the American Dental Hygienists Association, as well as a lifetime member of the American Association of Dental Office Management. She is the 2017 Esther Wilkins Distinguished Alumni of Forsyth Award recipient. She is also certified in dental infection prevention and control. Anne-Marie has been published in dental and dental hygiene publications and textbooks. She is a consultant dental hygiene examiner for the National Dental Hygiene Competency Assessment Organization. Anne-Marie presents continuing education programs for dental team members on a variety of topics. She has been employed as a software trainer, a business clinical advisor for a national dental practice management company, a faculty member of a dental hygiene program, and a program chair of a dental assisting program after having been employed in clinical hygiene for a number of years. Welcome, Anne-Marie. Today we are going to be talking about patient engagement.
So, thank you, Christine. Thanks for having me. I'm here in Boston, which is rainy today and cloudy and not great for a spring day. So I hope it's pleasant and sunny wherever your listeners are and wherever you are.
Yeah, we're fortunate today to have a nice spring day. So I want to talk to you because I know you do a lot of teaching about this and talking about this, but why do we need to engage our patients?
Our patients are our number one priority in our practices. So anything that we can do to help them understand their disease or their health is so important. So engaging them in whatever fashion we can is absolutely important to gain that health.
Yeah, I couldn't agree more. What are some of the common challenges that we face with patient engagement, and how do we address those?
So in terms of patients, it's a twofold question, actually. So in terms of patients, we have patients not opening up. You know, the dentistry has a bad rap, so to speak, because of the trust issues and all of that. The way media has been portrayed in dentistry, as well as just the pain that is associated oftentimes with dentistry. So patients have almost a wall set up so that they may not be open to hearing from us. Whereas from our professional side, time, technology, and money. Those are the three big things that cause us to have issues surrounding the challenges we're faced with in engaging our patients.
Yeah, sure. And yeah, all you have to do is think of the dentist in the Little Shop of Horrors.
Exactly.
Can you explain your understanding of the patient-centric care and the importance of it in dentistry?
Patient-centric care revolves around early detection. So whether that be early detection of caries, or we're recording this in April, so April is Oral Cancer Month. So thinking about early detection of oral cancer. So being, as I mentioned, the focus of your practice is the patient. So, whatever we need to do for our patients to engage them, whether that's be through technology or through other aspects in person or whatever we're doing to motivate them.
Yes, motivation is definitely key. Get them to floss, brush, all the things they need to do to keep their oral health in health. So how do you believe patient engagement contributes to overall oral health outcomes?
Because when we engage our patients, say, for example, using technology, and we'll talk a little bit about that in a few moments, but using technology helps our patients understand what their health or disease is. So patients, we're always on our phone, 24/7, all of us, we'd be lost without our technology. So using technology is so important in gaining that education, gaining that engagement of our patients.
Yeah, I can totally understand that. I actually lost my phone a couple weeks ago, and I had to get a new one right away because I didn't even have an alarm for the next day to get up and go to work.
Exactly. I've left the house sometimes without it, and I've turned around and come back home and to pick it up because I'm like, okay, I need it. What am I doing now?
Yeah, totally. So give us some examples of platforms or applications that you have utilized to improve patient communication.
So there are a number of different patient engagement programs out there, and I don't want to pigeonhole myself into any one particular one because they're all great. They all have their own positives and negatives. You can engage your patient through text messages or sending video messages or sending newsletters or email updates for your practice. And what practices need to be doing is engaging their patients on a regular basis. We know through marketing that it takes 5 to 7 touches for someone to actually move forward with whatever that process is that they're marketing. So regardless of your feelings about selling, and I use selling in quotation, in dentistry, we are selling. And so as such, when you sell, you also need to market. And when you're marketing, you need to keep touching your patients in whatever manner that may be. And all of the technology programs that are out there that are patient-centric and patient engagement-centric are excellent ways of contacting your patients, whether confirming an appointment or a bi-monthly or quarterly contact, however your practice is doing that, reaching out, telling them about your practice, what's new, what your team members are doing, what new CE you've participated in, all of those things.
And do you have some examples of programs or technology that you have used that works well for these touch points?
Like I said, I engage with all sorts of different companies. So in order to, I don't particularly favor one over the other. Whenever I do,
you don't want to endorse anyone particular.
Exactly.
That's okay. I understand. I totally understand.
In all of my CE programs, whenever I'm doing any type of product, I will always give the alternatives. Even if a particular company is sponsoring or facilitating the program, I will always offer other alternatives because that's what we need to know. What may be good for me may not necessarily be good for you.
I totally understand that. I'm a big proponent of that within the DSO space. One DSO might not be good for you, but it may be good for me. So I understand where you're coming from.
There's one
So,
furniture company in the area that advertises, they're talking about their mattresses, for example. And
mhm.
they say that, the owner of the company is saying, what's the best, is always asked, what's the best mattress? And his reply is, the best mattress for me is not necessarily the best mattress for you. And that's the same with technology in dentistry, whether that be regular technology, our practice management software, our CAD CAMs, or CBCTs, even including patient engagement. What's great for one practice may not necessarily be great for another.
Yeah. So, what methods do you use to educate patients with their dental treatment options?
So, using videos, emailing videos. There are a lot of companies out there that are involved in patient engagement that send videos. A lot of times patients will come in and you'll present a treatment plan and they say, oh, I have to talk to my significant other, or I have
Yeah.
to review, a little bit later. I'm not quite sure what it is. When they can review it on their own, at their own pace, it makes so much of a difference. Case acceptance can go up. So I definitely encourage offices to be using videos, whatever that may be, about their patients. And there are a number of different programs out there that involve that, as well as we are in dentistry are competing with patients' discretionary income. And
Hmm.
patients have limited discretionary income. So if they're sitting in your reception area and they're watching some TV channel that has a trip on it or advertising the latest iPhone, they're going to be more wanting to do that than taking care of their oral and systemic health. So, having in your reception area some sort of revolving information about your practice, about the treatments, about what you offer as a team. So, engaging your patients that way, as I mentioned, with the constant contact of patients. You don't want to bombard them, but there's that fine line between maintaining regular contact and being obnoxious. You don't want to be obnoxious. You don't want to do emails and all of that too much, but you still want to have those often touches.
Yeah, I love that. I know for myself that I love the text messages. Like my vet will send me, text messages when my dogs are due for their shots, and I'm glad they send repeated ones because I'm busy and I need those reminders.
Life gets in the way for everyone,
Yeah.
so those constant reminders are always beneficial. And it doesn't necessarily have to be something really heavy, it could be something light. We're having a holiday party at our office, or some offices like to dress up for Halloween, or take back the Halloween candy, those kinds of things. So yeah, it can be just maintaining the touch is the
Hmm.
most important part.
So, how do you ensure patients actively participate in their oral health decisions?
Well, whenever you are dealing with your patients, you always need to ask them, what is their preferred method of contact? Do they like phone calls? Do they? A lot of people still want to talk on the phone. Other people
Hmm.
say no. Send me a text message, send me an email. I'll be more apt to answer those than to answer my phone. So you always want to ask what their preferences are. You don't necessarily tell patients what they need to do. You ask them and you engage them. You ask those basically behavioral interviewing questions so that you can gain what their best method of communication is or what their pain point is in determining best treatment methods or treatment plans, all of that. Ask rather than tell.
Yeah, I like that. I recently heard someone say, make sure you ask for permission. And I'm like, oh,
Yep.
I love that.
Yeah,
Love that.
someone recently said that to me. So the same type of thing. When they're giving feedback, it's always good to ask for permission to give feedback or ask for permission about your oral health. This is what I see today, and I'd like
Right.
your permission to talk to you about it.
So what other technologies could we use to improve patient engagement?
There is so much in dentistry right now. Right now, the latest wave is artificial intelligence, and I'm a proponent of that. I do a lot of CE on that. I present a number of different programs, one of which is on that. And we talk about how artificial intelligence engages our patients. As I said before, we're 24/7 on our phones. Artificial intelligence is around us every day. Whether that be, we're talking to Siri or Alexa, or watching Netflix or Hulu. We're using artificial intelligence, and it's finally come into dentistry, and it's taking us by storm. But yet, there's pros and cons to it.
Sure.
And using it as a good technology for patient engagement is amazing. But you have to understand the why of AI, just like you need to understand the why of your practice management software. A lot of offices are using practice management software, and there's so much data in there that they're just surviving in it, and they don't understand how it can actually help them make their jobs easier, as well as making it more beneficial for their patients.
Yeah, I totally agree with that. Now, are there any certain trends or innovations that you're seeing that could really improve patient engagement?
Like I said, the AI. AI is going to be the big thing. We're just on the infancy of it within dentistry. Part of my programs, I talk about the future of it. It has an immense future in a number of different areas. Right now, we have it in periodontal charting, voice periodontal charting. We have it in imaging. We have it in patient calls, our calling centers, those types of things. But it's going to help in diagnosing oral cancer, for example, or another program that I deal with is TMJ. So how is it going to help move forward in that direction? How is it going to help in restorative and prosthetic dentistry, in implant dentistry? There's so many different areas that it's going to help. So we're just on the cusp of it.
I agree. It's going to be just booming here, I'm sure, real soon. Well, Anne-Marie, I'm so thankful that you took time out of your busy schedule to talk to me today. How can our listeners get a hold of you if they'd like to talk more about this?
So they can reach me via my website. It's DePalma Anne-Marie. I did it backwards. I didn't do Anne-Marie DePalma. I did DePalma Anne-Marie. Or emailing me. I know, Christine, you're going to be placing the email in the show notes, as well as just reaching out on LinkedIn as well.
Well, thank you again so much for sharing your valuable time with us today. I really, really am so glad that we talked about this, and patient engagement is so important to all of us.
Thank you, Christine. Thank you, everyone, for listening, and hope you have a great day.
I'd like to thank our sponsor, Twice as Nice Uniforms. Dressing for success, infection control, and comfort is crucial for the DSO team. Not only do they need to look great and feel great, but they need to be dressed for safety. Your patients will notice when your team is dressed appropriately, and your staff will perform better. Who better to help your team with these decisions than Twice as Nice Uniforms? Owned by a seasoned dental hygienist, branding expert, fit specialist, and fashion model, Twice as Nice uniforms are designed to follow infection control and OSHA regulations, alleviate the thermostat wars in your office with temperature-regulating technology, and provide long-lasting, professional-looking scrubs, lab coats, and accessories. Custom uniform programs will take the burden of painstaking ordering, exchanges, and returns off your shoulders. It's proudly made in the USA. And Twice as Nice is giving our listeners a discount code TDH2024 to take advantage of this special offer. Thank you for listening to the DSO Hygienist Podcast. Please follow or subscribe to be alerted of new episodes.